In recent years, clinics in the Philippines are commonly being opened within major shopping centers or renting areas out of large hospitals. Now we'll take a look at how this situation in the Philippines came about.
Large shopping centers like this one have become an integral part of the lives of many residents in the Philippines. Where there are people, there is money. Here, if you can establish a place to sell products or services, you can ensure an income.
After registration, patients will come here and they'll receive an eye exam.
Jumping on this trend, for the past 10 years, medical clinics and companies offering medical services have begun to establish themselves in shopping centers like this one.
And now is to have medical clinics in the mall. Each mall now has its own multi-specialty clinics. And so where people are, there are more clinics there. That's why there are fewer and fewer clinics now in an area in the community.
This dental clinic, located in a large commercial building, has been in business for almost 40 years, with a solid reputation and a daughter prepared to take over the family business. However, independent medical clinics like this one are becoming increasingly rare.
Before, back in the 60s, opening a medical clinic was quite a popular thing to do. Patients would be regulars and were used to the doctors. But it's quite different now. It's much more common to open clinics around hospitals.
Visiting a nearby hospital, medical clinics with the same services are scattered about in different areas. The hospital appears like an apartment building, renting space to different tenants. The reason is because in the Philippines, private hospitals make profits by renting space to private clinics by deducting a portion of the clinic's revenue.
We have used the American systems where clinics are most very commonly established within hospitals. After physicians complete their medical training, they often like to practice at a hospital, since it can be difficult financially to open one's own office, due mainly to tax rates.
With such high tax rates, doctors that open private clinics can't help but to increase their own fees. On average, the fees for a visit to an independent clinic start around $8, which is reasonable. However, that is a basic day's pay for the average worker in the Philippines. From an economic perspective, the average Filipino will choose the cheaper option over the service of a private clinic.
Mas okay po ako dito sa hospital, ma'am, kasi meron po akong asthma. Mas inaano ko po yung seguridad ng baby ko. Siyempre, ako din po.
Kasi yung doktor na pinagpapacheck up pa namin ngayon, doktor na namin matagal na. From sister-in-law ko tsaka sa eldest sister ko. Yun, tsaka kaya dito na kami pupunta.
Tigil nyo na. Huwag nyo na ibabalik, ha?
Another aspect of this system in the Philippines is the pharmaceutical industry. After visiting the hospital, the next stop afterward is often a pharmacy to pick up a prescription.
Insurance for the target is universal health care. It is being taken care of by Philippine Health Insurance Corporation. Right now, the enrollment is about 80%. The enrollment is not the problem. Sometimes it's the accessibility to the health center. We have 7,000 islands. If you live in one of the islands, even if you have the insurance, the expense for going to and from the hospital sometimes is not so affordable to those who are living in little islands. Most of them are fishermen.
With so many small islands, there are obstacles for many residents of the Philippines to receive good medical care. Not only is poverty a problem, but the national government has also not invested much into public welfare, an amount equal to only 3% of total GDP, a number that lags behind that of Malaysia, Singapore, and Thailand. The Philippines is a country of over 100 million people, and the World Bank asserts that by 2017, it will have the 12th largest economy in Asia, with the 9th largest market for pharmaceutical products. Facing such developments, the Philippines needs to take serious action to address the problems facing its national healthcare infrastructure.